My name is Jonathan Musher, and I have a practice in adult medicine in Chevy Chase, Maryland. I have a subspecialty in geriatrics and in pain management. When I was a kid, I loved Sherlock Holmes, which was kind of solving problems in one sense. And I loved how the body worked, really. I loved the physiology, and it just kind of merged. And I got really excited in the physiology and the changes in the body, and medicine just seemed to pull all that together, and it still excites me. I still love to be able to sit there and be a little Sherlockian, if you will, and try to solve problems. When I was doing my residency, I realized that there were some things I really didn't understand about getting older, and it just so happened that there was an ad in the paper, believe it or not, New York Times, and I saw an ad for a geriatric fellowship, and I said, let me try it. I loved it. I did 2 years in geriatric medicine, and it taught me so much about caring for everybody, not just the elderly. It helped me understand aging, but it also helped me be much more understanding and knowledgeable about what we call anti-aging or age management medicine. One of the things I discovered, however, is that there's an awful lot of problems in health and wellness that we haven't really even touched on. We've become a society too eager to take pills all the time. We want a quick fix. We want, okay, here's a pill for that. I've got a problem, take a pill. And it's not always that easy. And the other problem is it's not always the right thing for people. So I've blended my practice between traditional and what I call holistic medicine or alternative medicine, a health and wellness practice. There's so many times that I am able to actually take care of the person's problem by just helping them supplement and get the different nutrients that they need, and they feel better. If you would have asked me 10 years ago, should I, supplement, or, could I just get this? I would have said, you don't have to supplement, just eat healthy, okay? What did that really mean? I'm not sure. I used to say eat healthy, okay? Even if you live in a health food store, even if you sleep there, you're there 24 hours a day, you are not able to get the nutrients that you need, because normally it's 2 weeks from field to shelf for those products, and you've lost half the nutrient value. You can't eat healthy enough in the United States. Your body doesn't extract it as well, especially as we start to get older. And I'm a firm believer now that you have to supplement. We have to supplement with good high-end products. The other problem I have is that patients sit there and say, oh, I'm on a multivitamin. Well, what are they doing? They're doing one of those chewables. It doesn't help their kids, much less help any adult. They're doing nothing. The absorption is low. They're throwing money away, and it does nothing. You need a very good liquid multivitamin. I was scared when I first started doing this with my patients, when I looked into this and I said, I really want to talk more about health and wellness with my patients. I was scared that they were going to think I wasn't a good doctor, or that I'm a nut, or I'm, selling snake oil, or whatever. I mean, all the things that, you're really worried about. And in fact, the contrary happened. I never would have thought the patients would come in after getting, for example, on vitamin D, or getting on a good mixture of multivitamins, and they come in and say, Doc, I feel better. And the real struggle is half the time they fight me for 3 or 4 months before I'm even able to do that. I've got to convince them. I've got to almost twist their arm to say, look, just try this. They're feeling better. They are living longer. They're looking better. They're looking younger. And they're excited, and I'm excited. I get asked a lot from my patients, is this expensive? How much does this cost? And my first answer, and I'm not trying to be snide, is the cost of wellness is much cheaper than the cost of sickness. And my patients kind of stop a minute. And what I mean by that, and I explain it to them, is when I start giving you medicines for your high blood pressure, when I give you medicines for your cholesterol, when I start giving you all of these pills, there's a huge cost to that type of care. If I can get you on some health and wellness, some supplements, although there's a cost to that, the cost of being healthy is a heck of a lot cheaper than having to treat diseases and sometimes end up in the hospital. We've got to get back into health and wellness. We've got to have the passion that we had when we first started out in medicine to be able to do the things that we were taught to do, and that's help our patients. The first thing that we can do to help our patients is help them get healthy and stay healthy. I have hundreds of patients on these products. I'm my own best customer. I take most of these products and have never felt better. These products do what they say they're supposed to do. They are high-end products. They are evidence-based.